this is Jackyln Brumwell, and this is my sterile specimen collection and Foley catheter removal video. First you would clamp the catheter and wait 15 to 30 minutes to make sure that there's urine in the tube for collecting. The clamp on here doesn't want to stay, so I'm just telling you that I clamped it. I put on clean gloves and explain to the patient what I was about to do. And I would swab the port on the catheter in a circular motion. And I would obtain a 25 gauge syringe with a 5 to 10 milliliter syringe on it. 25 gauge needle with a 5 to 10 milliliter syringe on it. This is the only needle I have right here. Uncap it. And I would insert the needle at a 30 to 45 degree angle and pull back slowly on the syringe to make sure you don't collapse the catheter. And remove the syringe and swab the port on the catheter again in a circular motion. Take off the cap of the specimen cup, keeping the lid inside down, and insert the urine into the container. And put the safety on your needle. And cap the specimen and put the patient's name, date, and time of collection on the cup, and then send it down to lab within 5 to 10 minutes. And I put the needle in the sharps container. Then also this patient needs to have the catheter removed. So I would explain to the patient what we were going to do. And I would place Kleenex below the catheter to catch any dripping that might occur. I would also unclamp the catheter as soon as I was done taking the specimen. I would check the nurse's notes to make sure how many cc's were in the balloon when the catheter was inserted, and I would obtain a 10 milliliter syringe and attach it to the catheter port and drain the fluid from it, holding the catheter in place here. Make sure all the fluid was drained. Now, before I did this, I would drain the catheter bag just because it's easier to then just go and dispose it in the biohazard. And I would have the patient take a deep breath as I squeeze the catheter tubing as I pull the catheter out, and use the Kleenex to catch anything that might drip. And I would look at the catheter tip to make sure that it was still intact, and then the whole thing would go in the biohazards bag, as long as it was emptied first. Now I lower the patient's bed and go on chart.